Hi, my name is Annee Rempel. I'm an artist, cyclist, and fourth-year medical student at the University of Iowa Carver College of Medicine. During my first year of medical school, I started wondering what it truly means to be healthy, and realized how many students feel their own health declines as a result of starting medical school. Medical trainees often limit their own healthy behaviors in the name of learning to care for and counsel patients about those very same lifestyle behaviors. I began to wonder, is this the way it has to be? Do all doctors feel they must sacrifice their own health in order to lift up the health of their patients? Wouldn't patient care decline if healthcare providers, for example, never slept, only ate greasy hospital food, and didn't have the space to process the mental toll of things like working through 2+ years of a pandemic? During that time, I became interested in the work of Dr. Erica Frank out of the University of British Columbia. Her work suggests that physicians who practice what they preach are more effective when counseling patients and tend to have improved patient outcomes. I then began to ask myself, if physicians are indeed more effective when they themselves are able to embody health, do we not have an obligation to our patients and to our medical profession to be healthy? To explore these questions, I set off on a long-distance self-supported bike tour with my mom, who happens to also be a physician. Biking from Maine to Iowa allowed me to speak with physicians along our journey about how they balance their own health with a career in medicine, and to better understand my own definitions of health, as I often feel healthiest when I'm pedaling long distances on a bike. I met a med student who ran the Boston Marathon while studying for board exams, and was inspired by physicians who hike, knit, scuba dive, practice yoga, and do CrossFit. Most agreed that they are more effective doctors when they practice what they preach. Though I was reminded that medicine as a field often self-selects for able-bodied folks, and that doctors are humans and often unfairly held to high standards. When I returned from the bike trip, I started working with Dr. Lauris C. Kaldjian and Patrick B. Barlow to develop a survey tool to understand whether medical students believe they have a professional responsibility to live a healthy lifestyle. The results of our study were published in the Southern Medical Journal and illuminate something important. Medical students face a near constant ethical tension when navigating obligations to care for others and obligations to care for themselves. A majority of surveyed students believe health is multidimensional. And most students believe that physicians have a professional responsibility to practice the same healthy lifestyle behaviors that they recommend to their patients regarding smoking, alcohol, eating, exercising, and sleeping. Surveyed students believe those who practice healthy behaviors are more likely to counsel patients about those behaviors, are more confident when doing so, and that patients are more likely to follow their advice. A majority of students believe that even at an early stage in their medical training, they have a professional responsibility to try to live a healthy lifestyle. But sometimes that's just hard. Less than half of surveyed students engage in 2.5 hours of moderate intensity aerobic activity per week, an amount we are taught to recommend to patients. Over half of students are not sleeping the recommended 7 to 9 hours per night during medical training. And a majority of students would eat healthier if they had more time, more money, or if cooking didn't require so much effort. Among those who agree that health involves a spiritual dimension, 66.3% report that they spend 0 time over the course of the week engaged in spiritual or religious activities. It's clear that even if students believe they have a responsibility to be healthy, perhaps they are unable to meet the health standards they put forth for themselves. But what's also clear is students are trying. For example, a majority try to incorporate exercise into their daily routines by using the stairs instead of elevators or escalators when able. Students recognize that living a healthy lifestyle may increase their effectiveness, but they also acknowledge that the workload of being a medical student requires self-sacrifice, causing their own health to suffer. But many elements of this self-sacrifice are indeed patient-centered or altruistic. For example, the top 2 reasons students are willing to get less sleep than they should are 1, to learn what is needed to become a competent physician, and 2, to help their team care for patients while on clinical rotations. It's clear that medical students are constantly holding competing values in tension. Our findings illuminate a potential source of early burnout among medical students and warrant examination by those in medical education so students may be given more space to reflect and build ethical frameworks to better approach the inevitable tension created by valuing both self-care and patient care highly. Of note, this study took place just before the onset of the COVID-19 pandemic, but risks to a professional's well-being do not have to be immediately life-threatening from an airborne virus to be important. Finding a single solution is hard, but I will end by asking a few questions of you. How do you define health? In the midst of all that is stressful in medicine, how can we positively reframe time spent doing the things that make us feel healthy, knowing that it is not only acceptable, but responsible to make space for our own health? And how can we work together to build a community that values balance between patient care and self-care?